Hi, I'm Dr. Lewis. I'm a veterinarian here at the Poor Veterinary Hospital, and Sue, our practice manager, is going to be asking me some questions today about dogs' eyes.
Are certain dog breeds more prone to eye issues?
We see quite a few eye problems that are associated with certain breeds. So starting with the front part of the eye, we see a lot of breeds that are more susceptible to corneal disease because their eyes tend to bulge out more. They may be more susceptible to drying out. Dogs like pugs and shih tzus and so forth. The tear production can be reduced in some dogs. They may get a general loss of tears. Cocker spaniels, we see that quite commonly, and there may be sometimes some inflammation inside the eye that can start in the pink part of the eye, the conjunctiva, and spread across the eye. German Shepherds are a dog that are well known for that type of problem. We see some problems in the lens in a lot of dogs. Sometimes the lens can move within the eye, which it shouldn't. A lot of small terriers are susceptible to those, and then there are quite a few dogs that are more susceptible to glaucoma than other breeds. So some of the sled dog breeds, the Asian breeds, the Bassets, Beagles, and Cocker Spaniels, certainly they're well represented in that group as well.
How will cataracts be diagnosed in my dog, and what is the treatment?
Cataract formation is a very common question that we get because as dogs age, the lens continues to add layers, and so it will automatically become a little more opaque in all dogs. And as dogs age, at around the age of 7, ophthalmologists can detect that change with their specialized equipment. For us here, it's probably closer to 8 or so. And then owners can start to detect it probably 9 or 10 when their dog looks at them in the light or up in the sun. They notice that the center of the eye looks more cloudy and they're concerned about cataracts. In most cases, this is just an age-related change, but sometimes it is a cataract and then we may have to evaluate it. There are a number of different causes for cataracts and different types of cataracts. There are a lot of cataracts that are present at birth. They may be very tiny and we can only see them with a special light. They never progress in size. They don't bother the dog or interfere with vision. Some cataracts can arise as a result of medical problems. So diabetes, for instance, is a disease that can cause rapid onset of cataracts that can be really severe. And injuries and so forth can also cause cataracts. Many cataracts can be managed either just observationally or with medications. If the cataract is becoming more advanced, if it's starting to cause other medical problems, then they may have to be removed.
What is the best way to give my dog their eye medication?
So putting drops in the eye can be pretty simple or pretty much impossible. Some dogs are pretty accepting of getting eye drops, and you can do it in a sort of normal fashion as you would like person to person. Other dogs, we have to use some other techniques so that we're not having to chase them about the house. So in those situations, it's usually best to try to get the dog comfortable and settled, facing away from you, and then without letting them see the dropper bottle, to try to gently pull the upper lid back and then drop the drop from above the eye so they don't see the drop coming. Sometimes it's helpful to have another person who can talk to the dog or pet them, that sort of thing, to distract them while you're putting the drop in. And in these situations, sometimes a little peanut butter can go a long way as well.